Hi everyone, I thought today that we would look at something that might be really beneficial for school counsellors but also educators. What are some examples of some cognitive restructuring techniques that we can employ to help adolescents reframe their shoulds into more flexible, self-compassionate thoughts? So this cognitive restructuring is one of those components of cognitive behaviour therapy, CBT. It can be particularly effective and fairly straightforward actually in helping adolescents reframe their rigid should statements into more flexible, self-compassionate thoughts. And it's a small thing, but it actually does make a big difference. We can employ these different restructuring techniques to support the process. And one pretty powerful one is guiding adolescents to identify the specific should statements they're telling themselves, and then examining the validity and helpfulness of these beliefs. For example, if a student like Olivia expresses the belief that I should be getting straight A's in all my subjects, we can gently challenge this thought by asking questions that encourage her to consider alternative perspectives. Collaboratively, we can work with Olivia to reframe this should in a more self-compassionate way, such as, I would like to do my best in my studies, but it's unrealistic to expect perfection from myself. This reframed thought acknowledges her academic goals while also recognising the importance of self-care and realistic expectations. Another cognitive restructuring technique involves the use of positive affirmations or these kind of coping statements. So we can encourage adolescents to develop affirmations that counteract their perfectionistic shoulds, such as, I am doing my best and that is enough. Or, it's okay to make mistakes, that's how I learn and grow. By regularly repeating these affirmations, adolescents can reinforce a more self-accepting and compassionate inner dialogue. Additionally, we can guide adolescents in creating a reality checklist where they record evidence that challenges their should beliefs. For instance, if a student believes they should be the best athlete on the team, they could list examples of successful individuals who were not necessarily the best in their field, but still achieved great things. We can employ these cognitive restructuring techniques, and in doing so, we empower adolescents to reframe their rigid shoulds into more flexible, self-compassionate thoughts. This process not only alleviates the pressure and distress associated with that perfectionistic thinking, but also cultivates greater emotional resilience, self-acceptance, and overall well-being.